Now, as a psychiatrist, you asked about the developmental history. In the old days, they would emphasize things like, what age did you start using the bathroom? How was your toilet training? Stuff has nothing to do, basically, with anything useful as far as the psychiatric eval getting a developmental history. There are a few important points, though, that I emphasize. Not age of onset of potty training, or when did you stop sucking your thumb. That does have some importance, but not for an adult seeking psychiatric treatment, for example, right away. What you do ask for is things like, how far did you go in school? You do not want to miss mental retardation. Many patients as adults with mental retardation present with atypical psychiatric symptoms and get mislabeled schizophrenic and get prescribed dangerous medication that doesn't help and just hurts them in the long run. Yet there are severely mentally retarded patients that can respond to certain interesting combinations or other medications like mood stabilizers, anticonvulsants, anti-anxiety agents. But anyway, mental retardation can be suggested by history of learning disabilities, trouble in school. It also gives you an idea of how developed they are intellectually, because, say, suicide patients, they can't reason their way out oftentimes. Maybe they quit school, never developed analytic thinking. So that's important, I always ask about. The other thing is not at what age did you first have sexual relations. That's really not important right away. What you do want to ask about is history of abuse, sexual, emotional, physical, as a child. This increases risk of suicide. Repetitive, prolonged childhood sexual abuse is almost as high of a risk as eating disorder for suicide. So that's important. Also, where were they born and raised? They spend a lot of time where there's no light. Like born and raised in Alaska and it just moved to that's important. Siblings is important, brothers, sisters. You can then get into, describe your parents, how were they. And then if they're older, marriages, divorces, children. Legal charges are important. Say with meth patients, there's also a lot of legal problems. Maybe what religion, how's their housing, do they have any guns. These are things in the so-called developmental or social history the psychiatrist or medical doctor might get. Now a social worker might do a completely different full assessment. All the jobs you've had, how'd you get along at work, tell me about your marriages in depth, and they'll get into a lot more of the developmental history, but I only need a few key points most of the time. Thank you.